Hi, this is Dr. Rankin. Welcome to our recovery guide on lower eyelid after surgery. So if you are watching this video, it means that you have likely either been researching or have just had a lower eyelid surgery, usually called a lower eyelid blepharoplasty. The point of that surgery is to be able to smooth out that lower lid, create more rejuvenated or youthful contours, and overall just make you look less tired. So things that we want to do early after surgery in order to avoid getting something called ectropion, which is where the lid can be drawn down and create dry eyes, is that we want to do a lower lid massage. Obviously, if you have a different doctor and they have a different opinion, you should listen to your doctor. But for my patients, I like you to start doing lower lid massage during that first week. We'll talk about when to do that, but typically it's going to be somewhere around day 4 or 5. In which case, what we want to do is we want to actually stretch that lower lid up and over the globe, because obviously when we blink, our lower eyelids don't move very much. Our upper eyelid does most of the work there. And so in order to counteract some of the scarring forces that can occur in that lower lid, and again, draw that down, we want to make sure that it stays nice and loose so that it can continue to slide as there are some natural glide planes that exist within that lower eyelid. So again, the way that I would recommend doing this, and again, listen to your doctor, but around day 4 or 5, that we'll go ahead and have you look up towards the ceiling. You want to move the lid margin, or the part of the eyelid that carries the eyelashes. It's not a cheek, right? If you're pushing on the cheek, it's really not doing what it's intended to do. We want to look up. Go ahead and push up towards the ceiling. You hold for 3 seconds and let go. So you want to do that 3 times a day, and you hold for 3 seconds. Assuming that you've had both sides done, I think that it's easier to do one side and then the other side. The reason I don't necessarily recommend pushing directly in the middle, if your finger happens to slip or otherwise, getting yourself right smack in the middle of your eyeball is pretty uncomfortable. So just making sure that you're doing it safely, have nice, clean, dry fingers, and then again, go ahead, look up, push and hold, push and hold. I'm going to do that 3 times a day for 3 seconds. I hope that helps, and I look forward to taking care of you.